Everyone is still waiting on the vaccine, and the FDA may grant approval for the first vaccines this month. But who should get it first? The CDC recommends healthcare workers and long-term care residents and staff should be at the head of the line. Our John Sherrick is digging into what's next for us here in Georgia.
The expectation is that at first there may not be enough of the COVID vaccines to go around, even for the people who have just been approved to receive the shots at first. It will be a race to save lives.
The physicians on the CDC committee deciding on a Zoom call who should receive the first available doses of the COVID vaccines, realizing they are making life and death decisions. Dr. Peter Szilagyi of UCLA.
To me, this has been a Solomon's choice.
And after months of discussion, the CDC committee recommended by a vote of 13-1 who can get the COVID vaccine first. Upon FDA approval, the nation's 21 million healthcare personnel who are on the front lines and the 3 million residents and staff of long-term care facilities. Committee Chair Dr. Jose Romero summed up the committee's reasons.
Maximum benefit, minimum harm, promoting justice.
The one dissenting vote from Dr. Helen Cape Talbot of Vanderbilt University, worried, she said, that the vaccine side effects might be too powerful for many older people to withstand.
We hope it works and we hope it's safe. And that concerns me on many levels. I have no reservations for healthcare workers taking this vaccine.
A spokesperson for Georgia Governor Brian Kemp said Tuesday, "Our current plan is to follow the recommendations from the CDC committee." He was not able to say yet how many doses of the vaccine Georgia will receive from the initial allotment, or how many people in Georgia are in the groups eligible to receive the first shots.
Now the CDC committee will decide who should be in the next groups to receive the vaccines, with everyone eligible by summer.